Hello, it's Alexa, and welcome to Nurses Notes 101. I will be talking about the second component in the CCRN cardiovascular, which, like I said previously, is 17% of the
I ran all the way
exam.
back here to get fucking
In this chapter,
video
we'll focus
vests.
on acute peripheral
Nothing easy,
vascular
huh?
insufficiency. So it's all disorders that cause blood vessels to narrow, spasm, or be blocked. So,
Please stand up.
the topics that I'll be speaking about are arterial or venous occlusions, carotid artery stenosis, the procedure known as endarterectomy, and also the procedure known as a femoral-popliteal bypass. So, first off, an arterial or a venous occlusion. So, arterial occlusions are mostly 90% caused by atherosclerosis. So, this is an accumulation of fatty deposits in your blood vessel. Venous occlusions are usually caused from just clots. So, not exactly fatty deposits, but actual clots forming. Um, Fatty deposits are not common in veins, only in arteries. The way we diagnose either of these are through an angiogram and an ultrasound. Usually, they do an ultrasound of the legs to assess for venous occlusions. We'll do that to assess for things called DVTs, deep vein thrombosis, or angiograms are done. They can be done peripherally, but a lot of times an angiogram is done straight into the coronaries as well. The treatment of either of these disorders and occlusions, if it's just a minor problem, healthy eating and exercise. They might put you on a baby aspirin. If they're a major problem, to prevent further blood clots, they can put you on stronger medications like Coumadin, which would have the patient test their INR every month to make sure the levels are fine. They would do stents via an
And extra
angioplasty,
plate.
or they would actually surgically remove the clot. Um, so that's most common, usually peripheral clots. Our second topic in this discussion is carotid artery stenosis. So, stenosis is just a reduction of blood through fluid narrow vessel. And with carotid artery stenosis, this shows reduced flow of oxygen to the brain, and it's due to a buildup of plaque in the carotid arteries. The carotid arteries, like we all know, are the large arteries of the neck, and when these become blocked, the signs and symptoms that we see in patients usually would manifest kind of like a stroke. So they would have blurred vision, confusion, memory loss, numbness, and weakness. Treatments that we would give for patients with carotid artery stenosis would be blood thinners to make sure that blood is flowing, so aspirin and Plavix. And if the stenosis is severe enough, and if the patient's having lots of symptomology, lots of confusion, lots of issues with seeing, um, and let's say they have a strong history of strokes in their family, then the patient would probably undergo a carotid endarterectomy,
Guy behind us. Guy behind us.
which we're going to talk about in the next slide. A carotid endarterectomy. So in this picture here, you can see that there is a lot of carotid stenosis due to a buildup of plaque, which restricts the blood flow in the first picture
There's a
here.
guy right next to us.
So with the carotid endarterectomy, the plaque is removed. The vessel is then sutured in place,
Too broken.
which in return promotes normal blood flow. So, to further explain, a carotid endarterectomy is a surgical procedure to remove a buildup of fatty plaques in the carotid artery. A buildup of plaques in the carotids can cause carotid stenosis, which, like I said before, is the number one cause of stroke and cerebral ischemia. The last topic in this discussion is another procedure called a femoral popliteal bypass. So this is commonly for clots in the femoral artery. So this is when a surgeon will create collateral circulation by
Another one.
bypass. So they bypass an artery that has a clot. During the surgery, a graft is placed by the bypassed blocked artery flow. So usually this blockage is caused by plaque or atherosclerosis. So like we can see in this picture I put here, the graft is put kind of like parallel to where the clot is, and it
Any
makes
place.
a new like line of travel for the blood to flow through. So the patient can have full blood flow to the full extremity and
Anybody
kind of
got
like
plates?
divert the blood flow from where the blockage is. Okay, so that's it on the second topics of coronary artery disorders and treatment for the CCRN. Thank you for listening. Like and subscribe.